I'm going to offer advice, which is like not typically my style, but I've been thinking about it. And so many people who respond to my comments are looking for a therapist, particularly one who is affirming around neurodiversity and queerness. So I wanted to put forth like 3 or 4 questions I might ask if I were interviewing a therapist, which is what you should be doing. When you meet with somebody new, you should interview them to see if you guys are a good fit. Like, it's a really serious decision, so don't just go with it because you got an appointment. So number 1, the question I would ask is, what is your relationship with diagnosis and the DSM? And there's not a right answer to that question. It's just that you actually need to know. You need to know where the person functions in relationship to those things, how much they've deconstructed their thinking, how important they understand diagnosis can be, but also can like sort of hold it at bay. You want to know if somebody is practicing in a way where diagnosis is informing their treatment, like what's going on with them in diagnosis. Where is all of that for them? 2, I would ask them who their mentors are. And, you know, are they like old white men who wrote books a really, really long time ago and haven't taken in a lot of the evolving information we're learning about mental health, the body, the nervous system? I would love it if one of the answers to those questions for you from a therapist is that one of their mentors is their own therapist. Because you want somebody who's learned how to be on the other side of the couch and the other side of the screen, whatever the case may be. It's just really important to know that somebody's done their own inner work. And I think that the 3rd thing I would ask, because I would want to know how adept the therapist is at being direct, is how will I know if I have violated a boundary of yours, and how can I tell you if I feel like you've violated a boundary of mine? The reason I say that is because boundary work has to be pretty explicit in therapy, and people are really scared to like say things about boundaries. And if you don't have that sort of established with your therapist, and you feel like your therapist is like another person in your life that you're doing guesswork around and trying to pick up on social cues around, then it's going to be a really anxiety provoking dynamic. But if you feel like your therapist is comfortable being direct and has given you permission to be direct as well, you're going to have a much stronger foundation for the work.